Preventing veteran suicides has been our top calling as Legionnaires and continues to be. Our next speaker has been actively involved in that issue. He served as a Marine Corps Scout Sniper and is a veteran of Operation Iraqi Freedom. He is currently Colorado's Veterans Suicide Prevention Coordinator. Please welcome Matt Wetenkamp.
Hello, thank you. Thank you to Chairman Bozzella, the VA and our commission who I've been working with on this issue for inviting me here to speak. A special thank you to Joshua Hastings out of the national office. It's been great working with you. I feel like I appreciate you not only as a colleague and a peer, but as a friend now, so thank you for everything. Thank you to my wife for being here today. Appreciate you. But largely thank you to the American Legion. You all may be aware the American Legion passed a resolution recently on lethal means safety. The language in it I thought was brilliant, it was perfect, it hit all of the important points, including at the very end, talking about the Second Amendment and its importance. So thank you to the American Legion for stepping up, for seeing a need, and passing that resolution. A brief bit about my background because I think it's relevant to this conversation. I'm a lifelong gun owner. I grew up hunting in a family owned guns, a lot of hunting and shooting. I joined the Marine Corps out of high school. September 11th of 2000 was my first day in the Marines. I was a scout sniper deployed to Iraq in 2003 as part of the initial invasion. Been a gun owner ever since. I spent the last 10 years or so working in veteran services, nonprofits, universities, community outreach and partnerships, but most specifically recently, mental health. And that's when I really started diving in, and how I think about mental health and guns and suicide really started to change. And several years ago, a group was founding in Colorado. You may have heard of it. It's a national initiative between the VA and SAMHSA called the Governor's Challenge to prevent suicide amongst service members, veterans, and their families. The Colorado team was among the initial cohort of states to join. And we were laying out in the early days of this what our key priority areas would be. There were going to be 4, and pretty much everybody in the room agreed that lethal means safety should be one of those 4. There's always one, and there was one in the room who said, "You all have lost your minds. You want us to commit 25% of our attention to convincing veterans to give up their guns? You're on your own with that one." And I had been through all the trainings. At this point, I had been in veteran services for years, working with wounded warriors, assist training. You name it, the list is long, and every single one of them mentioned guns and lethal means safety. So I had all the info, I'd been given all the information, it was there, but it didn't register, it hadn't stuck with me. So I was in that meeting thinking things and saying things like, guns are just the tool, they're the end result. We need to focus upstream, the mental health problems, before they ever get to reaching for the gun. Which is true, there's a lot of great work going on that front, but I didn't have that full picture of the guns and suicide piece. Thankfully, they ignored me and kept lethal means safety as one of the 4 priority areas. And fast forward, I had left that position, and the director of Colorado's Office of Suicide Prevention, the same person who reached out to me to join the Governor's Challenge earlier, now reached out to me to offer me a job. She said, "We've got this project in Colorado. It's called the Gun Shop Project. It's a lethal means safety initiative reaching out to communities." I thought to myself, why is she reaching out to me? Does she not remember what I said about guns and suicide? I was reminded recently that she also remembered something I said that day, which anybody who knows me is not surprised because I say this all the time, but I strive to go through life with a mind into being changed. If I'm wrong, if I'm that one person at the table, everybody else gets it and I'm wrong, I don't want to be that person. What am I missing? Show me. So I took the job and I jumped in, and it was all the same trainings, it was all the same information. So I had to dig deeper and kind of look at it not as a clinician or a public health official or a researcher, because I'm none of those things. I'm just a veteran, gun owner, So I had to look at it from the veteran and gun owner perspective. And here's what I found out and changed my mind. The first thing that jumped out at me was this thought that, well, if it's not a gun today, it'll be something else tomorrow or next week or next month. Someone who's suicidal and wants to die, they'll find a way eventually. And I found out that might not be true. What we see is that the vast majority of suicides happen within one day of a personal crisis. And this is whether that person has had prior issues, mental health issues, or not. One day of a personal crisis. Job loss, dire medical diagnosis, divorce papers, loss of a child or close family member. Studies of suicide attempt survivors show that a very, very short window of time typically passes before first contemplating suicide and actually attempting. Every study shows this. Less than 8 hours, 80% less than 8 hours, 60% less than 1 hour. The number that always stuck with me was one study showed that 50% of these suicide attempt survivors reported considering for less than 10 minutes. 50% thought about it for less than 10 minutes of what was likely the worst point in their lives. And it made me think about all the work I've done in outreach. How many times over the years have I heard a veteran say to me, I don't need therapy, I don't need counseling, I don't need mental health services. I'm not crazy, my life just sucks. And that's what I've learned is that is mental health issues. Getting served with divorce papers 2 weeks after you got fired, that's not just life sucks, that's mental health issues that we have resources for. Many of you in the audience are those resources. We are those resources to each other. And the second thing I'd learned is that the availability and accessibility and lethality of the various means of attempting available to someone in that window really matter. Studies of these survivors show that someone is more likely to delay attempting or even not attempt at all if the perceived lethality of the means available to them aren't high enough. There's a small study, mostly young men, who all survived attempting suicide with a firearm. I always like how they describe that study, right? It's a bit redundant. A small study of people who attempted suicide with a firearm. Going to be small. I met one of those people recently, actually. His name is Eric. He lives in a rural corner of northwest Colorado. And he, years ago, attempted suicide with a shotgun. And he bears the scars to prove it. But he uses those scars, he takes those scars out into the community now to talk to fellow gun owners about how grateful he is to be alive. And again, focusing on the availability and the accessibility actually works. And we've seen it for close to a century now all over the world. It doesn't matter what the society is or what the most lethal means of suicide for that given community, it doesn't matter what it is. It could be town gas, over-the-counter medications, illicit drugs across Europe, pesticides in various Asian countries. Even most recently with the Israeli Defense Force firearms, we see that whatever the means are that are killing that society's friends, families, and neighbors more than anything else, we focus on that and we talk about it and we care about the availability and the accessibility of it to the people among us who are vulnerable. Lives are saved and the suicide numbers start to drop. And the third point to all this that ties it together for me is that word I keep using, it's the lethality piece. I always want to pause here when we think about lethality and talk about lethality of firearms. We know that attempts with a firearm are 90% fatal or higher. We take all the other attempts together, combine, they're fatal around 5% of the time. But I lost a friend of mine in high school to a suicide attempt that was not with a firearm. His suicide attempt was not 5% fatal. I just want to acknowledge that to those that we have lost that were not to firearms. There's ways of looking at all of these numbers, and so a moment to acknowledge those that all that have been lost. But the point remains, firearms are a lethal tool. We know that as gun owners, as veterans. I'm always perplexed by this. I do outreach in the community, and someone might say to me, why are you focused on guns? Leave us alone. You out talking to people about cars and ropes and belts and razor blades and caring about who has that? Well, no, I'm not. Are you carrying a rope in your holster? Guns are a tool. We as veterans know that better than anybody. They're a very, very lethal tool, designed for a very specific job, and they're good at it. You often see in this topic things like a firearm in the house or firearm ownership is an increased risk for suicide, or it indicates an increased risk for suicide. And I know as a gun owner, and I've heard other gun owners say something to the effect, what are you saying we're crazy? Gun owners are crazy. We're more likely to die by suicide. Well, no. Again, it can happen to anyone. These are the life crises that are thrown at us and our friends, family, and neighbors every single day. It can happen to anyone. The difference is when gun owners hit that lowest point, when they're in that tiny window of crisis, when it feels like the world is closing in and there are no options, there's no way out, how is this going to end other than if I end it? When they reach out, they have the 90% lethal tool at arm's reach. It's an impulsive act at our lowest point. So we know all this, right? So we've got the small window of crisis, the lethality of firearms, all these things we know. It paints the picture. Well, what can we do then? What is our role as veterans, as gun owners? Well, another thing you see in firearms research is that in every single study of gun owners, the number one reason for owning a gun, it's about protection. Protection of my community, protection of myself and others, protection of my family. It's always about protection. We are protectors. Recently in my home state of Colorado, in Boulder, mass shooting at a grocery store. How many gun owners do you imagine themselves to be just the sort of person who, if they were in that grocery store that day armed, maybe only one person would have died? How many people in this room feel that way? If you were in that grocery store that day armed, perhaps only the shooter would have died. I feel that way about myself. I can say that with confidence. But if I imagine myself to be the sort of person who would draw my weapon in defense of others, what else will I do in defense? Another point to all this I mentioned at the beginning, it's that term, gun control. Too often I feel the people talking about lethal means safety work in public health. They work for the government. They have a lot of initials after their names, or maybe just one initial, but it's the wrong one. And so it complicates everything on this topic of guns. And so to those who look at this topic of lethal means safety and guns and suicide and say, you know what, I know what that is. That's a Trojan horse heading towards gun control, and I want no part of it. Friends, I say to you, this is the opposite of that. This is keeping efforts of gun control perhaps at arm's reach. It's saying, yes, red flag laws, ERPO, confiscation, those are technically options, but we're going to keep those there. We've got this as protectors of our community. As gun owners, no one knows better than us the lethality of these tools, and we'll look out for one another. Imagine a decade from now. What would happen if the suicide numbers in this country had plummeted? And it was largely as a result of fewer attempts with firearms. Imagine if, imagine reading a retrospective in the New York Times a decade from now, applauding gun owners for standing up and taking the initiative to say, this is a problem and it's affecting all of our communities, it's destroying families, and rather than your solutions, we have solutions in our community. So what does that sound like? What does it feel like? What does it look like? Well, it's hard to say because the solution's always going to be different. Does that household need a gun in it 24/7 because of work? What is available in that community for storage? There's a million different possibilities that arise, but we have to keep those principles in mind. One day, what's within arm's reach? One thing is 90% fatal, everything else less than 10. There's a couple ways of framing this that I leave you with that have been useful for me over the years, that have motivated me to take action. Now, for me, when someone reaches out to me and says, hey, so-and-so's in trouble, the first thing that comes to my mind is, do they have guns? Do they have access to the other guns in the house? Is there somewhere we can keep them for a few days till the dust clears? The first analogy that I love to share is drinking and driving, and how we've changed how we think about that and how we talk about that and what is and is not socially acceptable. Imagine yourself closing down a bar with your friend. Late at night, you've been there for hours. It's closing time, the lights turn on, friend starts to slide off the stool, can't find the keys. What are you reaching for your keys for, friend? You're not driving home. We've been here all night. You can barely stand. It's fine. I can drive. Walk. Take an Uber. Anything, please. That's what any sane person would do, right? You're a protector of your friend. Now imagine if the bartender leans over the bar and says, leave your friend alone. What difference does it make? He could trip on the curb. He's drunk. He could trip on the curb walking home, smash his head, die. The taxi or Uber could get hit by a semi. He can die anyway he gets home. What does the means matter? Of course the means matters. You're infinitely more likely to survive, and those around you are likely to survive with those other options rather than driving. You are the bartender in this situation. You're the leaders in your communities, post commanders, post leaders, welcoming in the new veteran who just joined. You're the ones who know about who got served with divorce papers and who got fired, whose kids are really sick. We need your leadership in the community. We need you to be the voice of reason as gun owners who can say, from the perspective of a gun owner and a protector of the Second Amendment and gun rights in this country, and say, let me help. Here's why this matters. You, your problems, and your guns are safe with me till things are better. So head home to your communities. Take this with you. Remember how much this matters, that window of crisis. It doesn't have to be grand. You don't have to say it perfect. There is no perfect way to tell somebody, I care about you, I'm worried about you. We need you here. Can I hold your guns for a couple days? It's going over to your girlfriend's house because she had a miscarriage 2 months ago, and then today her husband told her he wants a divorce. Just go tell her you're thinking about her. See if you can take her gun to your safe for the night. It's going over to the new guy who just joined the post, and you find out he's in trouble. He got fired last week and got home today to an emptied out house and divorce papers. It's going over there, knocking on his door, making eye contact and telling him, I'm worried about you. This sucks. But we'll get through it. I've got a lawyer actually for my divorce. I'll connect you with her tomorrow. She's fantastic. I got to get home to Samantha. It's bedtime. Got to be there for bedtime. But I'm not going to be able to sleep tonight knowing you're here alone, empty house, you and all those guns here. Can I change the code in your safe? I'll come back tomorrow. We'll get connected with the lawyer. I know. I know you wouldn't. But do it for me. I won't be able to sleep tonight knowing you're here. So let me change the code. I'll come and do it back tomorrow after we get you connected to the lawyer. Or come stay in my place. It doesn't have to be perfect. Just have the conversation. Reach out. I mentioned the mass shooting earlier. Imagine the sort of feeling you would carry with you for the rest of your life knowing you had saved a dozen people by stopping a mass shooting. Could there be any higher moment in one's life than saving that many lives? There's a mass shooting every day of veterans in this country, and we can stop it together. And it doesn't take you drawing your weapon and using it on another human being. All it takes is conversation, an extended hand, and telling those in our communities who are vulnerable that we've got them. Thank you.
Matt, thank you. I'd like to make this a presentation of one of our medallions.
Thank you, sir.
Thank you.
Thank you so much.
Appreciate you.